COVID-19 vaccine tomorrow. I'm going to get my jab tomorrow. This is because our facility has gotten 2,000 doses from Nairobi Metropolitan Services, and this is what we are going to do. Sorry, a slight distraction from my beautiful daughter behind me. So tomorrow I'm going to be taking my jab, and I'll tell you. So the first reason is because we'll get 2,000 doses from the NMS in our facility tomorrow, and I'll be first online to get the jab. Now, the vaccine I'll be taking is the Astrazeneca Oxford University vaccine that has been discontinued in many countries now, including Denmark, Norway, France, I think Spain, and a few more European countries. And I'll tell you why that's the case. But more importantly, in Africa today, COVID is behaving like the boy who cried wolf very many times. So the first time the boy cried wolf, everyone was very panicked, and they came out to see, okay, what's this issue about? And they found it's not a big deal, and they went back. And the next time, so this has been COVID story in Africa, where every time there's a cry out, okay, be careful, there's a surge, there's all this, and then the impact has not been as bad as in other countries in the West. However, there's that one time when the wolf actually came for the boy, and I think at that time it was important that the people would come out, and at that time people weren't responsive. And the same thing I'm seeing in Kenya today, because right now we had a taste of a terrible COVID surge in November last year, October, November, and then all of a sudden that wave just disappeared. And yes, we were afraid at some point we'll run out of ICU beds. It didn't quite happen, and all of a sudden just COVID just disappeared as if by miracle. And so when people speak about a surge in 2021 March, people don't understand it. And I'm telling you, it's bad this time, because for a fact, as of yesterday, they didn't have a single bed in ICU, and more or less, there are patients calling, people calling for patients all over, from Nyeri, from Nakuru, from within Nairobi, and getting an ICU bed is very difficult. And now the number of cases are going up. To just today, I think we had one of the highest positivity rates of all people tested. 16% tested positive, I think 16, 17%. Granted, this is skewed because only those with symptoms will be tested to a large extent, or those who seek to travel. And so I want to share something that I shared about COVID-19 on 5th of February 2021. The numbers here were nothing to write home about. I think we were doing less than maybe 2 or 3% positivity rate, and there was no reason really to feel this. But I don't know, quite early on, I got a bit jittery. I've been in ICU for a very long time. I think I'm in my 10th year of critical care, and I have had to take care of COVID-19 patients in Kenya, in particular over the last couple of months, and more so in the last couple of weeks. And so, whereas in January and February, we sort of didn't have many, January and December, we sort of had a decline and very, very few positive cases. All of a sudden in February, you'd get a case, two cases of people turning positive. And I think the trend of COVID, if you look at how the pattern goes, it may actually, I think around this time, around 5th of February, I was beginning to get a bit concerned. Of course, I can't explain it fully, but just putting together some trends that are a little bit more abstract. And I wrote, I'm a bit jittery about COVID-19 trends over the next few weeks. Nothing concrete, but some jitters for sure. And so this jitteriness was quite, it's not magic. It's just some data that I'm processing. I do this a lot. And then a week later, on the 10th of February, I just quoted that tweet that I'd just shown you. And this is what I wrote. I said, just over a week ago, I posted this tweet that I was referring to. Now I urge extreme caution. It's not being a doctor, though that exposes me to data, but something I can't explain, some subconscious process finding order in the chaos before it becomes concrete. And I said then that the next few weeks would be critical. Unfortunately, the next few weeks is where we are now, and for sure, we're in the 5th week from this street, and the situation is quite dire. As of yesterday, I think very many ICU beds were completely occupied, and I do know there have been very unfortunate cases reported. I can't begin to explain how bad it is. We had reports about Italy, and we had reports about um, other countries in Europe, even South Africa, some African countries that were going through really terrible period. And so this is where we are. Unfortunately, in this time, the Kenyan population, nobody's wearing a mask. nobody's concerned, and it's terrible. Really, it's absolutely terrible. And so I'm saying right now, knowing what I know, dealing with what I'm dealing with on a daily basis, I'd highly recommend that if you have access to a vaccine, especially if you're in a vulnerable group, go ahead and get that vaccine. And I'm saying this knowing full well that Kenya has the Oxford Astrazeneca vaccine that was one discontinued in South Africa because in SA they found it not effective against a variant that they were dealing with in South Africa, and two has been discontinued because it was for creating some blood clots in some European countries. Put that into context, I want us to just look at something that some of the data. This is the British Medical Journal, highly reputed journal that would be able to sort of explain a couple of details. And it's telling us the story of Denmark, which had suspended the use of the vaccine as a precautionary move after reports of blood clots. And blood clotting, if you're not familiar with this, you'd have clots further off, and these clots can be dislodged. And if they come and block the vessels in the lungs, you can actually lack oxygen and die, and it's quite there. I think there was one reported death, and I think at least 10 cases. But then again, in context, as of today, I think more than 17 million vaccines have been given. 17 million versions of this vaccine have been given. I think in the UK alone, over 11 million vaccines have been given. And therefore, the ratios reported are very limited. There could be many factors underlying this discussion. However, knowing that every single vaccine has been rushed, every single one of them. Vaccine development typically takes up to 10 days, but this particular time, these ones have been done 10 years, not 10 days. These ones have been done in a year or less, and so you can imagine that not all safety checks are there. And so taking a vaccine is a big risk. But I'm telling you, for those above 65 years of age, for those above with diabetes, with hypertension, and so on, I really would tell you that the risk of vaccination is much lower than the risk of the disease itself. I've been in critical care, as I've said, for going to 10 years now, 9 towards 10. I've had severe lung disease patients before, patients on ventilator, all the protocols that are available. I'm telling you that nothing compares to COVID-19 in terms of the impact it has in the lungs. We are much better at it, and we're getting a few more patients who are critical on ventilator going home. But that is still one of the biggest struggles that we have. Um, I really would want to urge us to be a little bit cautious. Allow me. Stella, I'm streaming and it's not. Please, please, mommy, please. Not working. What is not working? Can you push it? Okay, because it's finished. Call sister to help you. I'll come and help you in a few. Okay, so this is working from home. Okay, and so yeah, where was I? I've completely lost track of that. But yeah, so there could be many factors around COVID-19, the vaccine, and the reasons around it. I've been working in ICU for close to 10 years now, and I've been involved in the management of critical care cases. And right now, as compared to November, we are getting quite a number of patients off ventilator. Of course, I'd say at a personal level, I've made some modifications, and in terms of winning the patients off the ventilator, a bit of expedited process, and the outcomes are much better than before. But that notwithstanding, there's still some actually many unfortunate cases, and the bigger risk has never been just the hospitals being full, but the hospitals being full to a point where sick patients are being turned away, and there's nowhere they can go to. I had a report saying that Kenya requires 700 ICU beds. That's a joke. Kenya requires numerous ICU beds. As of today, I know I heard of about 20 something patients needing oxygen. I know that's a joke as well, because in my facility alone, we have over 28 patients who are on oxygen already. I don't think we have 110% of all the patients need oxygen in the country. So there's significant underreporting. I don't blame the people doing the reporting, because I know that data is not adequately collated. And just because of the laxity that has been shown in tracking COVID-19, I think this is what we're seeing. However, the reality is this. If you look at this tweet in 5th of February, and you look at this tweet 10th of February, and where we are today, this trend is not, you can be sure that I'm not just picking some random things from my mind. It's actually a trend that I have observed. I don't know how to explain how this happens in terms of this clarity of maybe if I take a bit of time, I'm able to explain that and just look through and see. But then just to know that trend is pretty much clear. And I'm concerned extremely that we're facing a difficult time. So if I could get a vaccine for people around me, if I could get a vaccine for myself, if we can get to herd immunity as quickly as possible, we stand a good chance. Yes, there is a possibility that the vaccines won't be effective. Yes, there's a possibility that, okay, the Astrazeneca vaccine is about 60% effective, but that's better than nothing. If you can stop someone from getting severe critical disease, the benefit of that will be tremendous. And the cost of healthcare around COVID-19 is absolutely astounding. And so I'm going to encourage everybody who has access to vaccination to get that vaccine. And I really wish that the government would expand access to this vaccine beyond the healthcare workers. If the frontline workers, not healthcare workers are very few. I think all healthcare workers can be vaccinated within 20% of the vaccines that are available in the country. That's over 1 million doses. That's how few healthcare workers are in this country. But then to extend this to those who are vulnerable, anybody above the age of 65 years of age, anybody who has diabetes, hypertension, heart disease, kidney disease, cancer, obesity is a really big factor. If your BMI is above 35, probably sometimes above 30, you're battling obesity, there's a big risk of critical disease. And something else you're seeing is that very many young people are coming to hospital with severe and critical disease. So yeah, that's where we are. And for some reason, because COVID has been this boy who has cried wolf one too many times, we don't believe him anymore because he's done this. Cries wolf in March. We spend 3 billion shillings just buying PPEs that were, and uh, yeah, that was it. Then cried wolf a second time, and yes, that was a bit more severe. Now we're in a situation. I don't think this is a third wave. I think this is really our second wave. But then if you look at the graphs do indicate this could be a third wave that we're into. But there's a very big possibility that this third wave is nothing like we've seen before. Um, um, I'll say it here. I think the reason why we are seeing this impact now, as a country, we opened schools about 2 months ago. We opened pubs a few months earlier, and public transport went back almost normal. The use of masks and public measures were reduced a couple of months ago, and we thought this impact would be seen around. I think the whole scientific world has got it wrong. Just trust what I'm saying. There is not completely out there. There's a process through which I'm able to make these kinds of suggestions. I think the whole sort of we are from the time when we have an event like say opening of removal of restrictions, the spread of COVID-19 in community to a point when we have a problem to deal with is much longer. It takes months, not weeks. And so when you saw Italy in the problem it was, that problem had started. Hello, how are you? That problem had started a couple of see, I'm streaming. Hello. I'm waiting for the water and taking a long time. Fine, I'm about to finish, then I come. Give me exactly 5 minutes, then I come and sort you out. Could you see if sister will help you? Okay, fine. You'll wait? Fair enough, you wait. So when I think when the whole discussion around COVID has matured and we take away geopolitics from all of this, we will discover that the surges we are seeing in any country, including Italy back then in 2020, these were the results of uh, spread that began months before. Of course, that has its own implications with regards to Wuhan and everything else, but that's a reality. So, what Kenya is witnessing today in March is definitely the consequence of what we did in December and January. And I think this may explain why a lot of African countries are seeing surges way after. It means that there's a very big possibility that the spread we are seeing in European countries actually happened way before December of 2019, and it's very possible that the virus has been with us for quite a bit longer. Well, that's what I think. I may be wrong, of course, but given where the surges are happening versus where the events are happening, it's very possible. That said, I'll be having my vaccine tomorrow. I hope to catch that at least one way or another. share to give confidence. Well, there's no point recommending something that I myself will not take, and so I'm going to take that vaccine and hope for the best. Cheers, leave a comment. Please take COVID-19 seriously. Please take COVID-19 seriously. Yeah, today, someone close to me was sharing that they had asked their work colleagues to put on masks, and people were laughing. You know, you're laughing because you can't see the monster around the corner. And I'm telling you today, take COVID-19 seriously. If be as afraid